The Royal Society for Public Health is campaigning to change UK drugs policy to help reduce the health harms to the public's health. We want to better support people to avoid using drugs, reduce the harm they encounter from them when they do use them, and aid them in recovery.
We're in Liverpool, which has high rates of drug use and binge drinking, and among the highest death rates from drug use. We're here to ask the people of Liverpool what they think about current drugs policy, what changes they would make, and how we can reduce the health consequences from drug misuse.
I think drug users who have a problem with drugs need therapy, not locking up. They need help.
I don't think people should be treated as criminals when they take drugs, because it depends on what background they've come from to why they take it. It depends on how they've been brought up, how they've socialised.
If they do, then they are.
Yeah.
If they harm other people, they're a criminal.
I do think marijuana should be legal for medicinal purposes. I don't think you should be able to just buy it freely.
We shouldn't treat all drugs the same. Some are harmful. Like I'm not against the policy on some drugs. Some drugs shouldn't be legal.
I think the police need to crack down a bit more on the drugs. Like, I know a lot of people that just smoke weed, and there's a lot of like coke around, especially where I live, and the police don't really bother with it. They just see it and they don't really crack down on it. I think they need to do a bit more about that.
People have serious injuries and like chronic diseases, and it helps.
I think alcohol is more harmful than most drugs out there, because of liver failure, cancer rate, puts cancer rates up.
If you look at Netherlands, Amsterdam, marijuana is legal over there, and it does help the society. For example, crimes are a lot less over there, and medical marijuana is probably beneficial for people.
I think weed should be legalised because it helps with medical research, it can help with pain.
I think people that take drugs shouldn't be treated as criminals at all.
I don't think they're doing anything wrong to other people.
It's different though, depending on what drug it is, personally.
I think obviously you've got classes, you've got your C's, your B's and your A's. I think if you get caught with class A's instead of a criminal record, it should help.
Yeah.
Do you know, instead of getting criminalised for it and prosecuted.
We came to a bar to ask the people of Liverpool to choose their poison.
Based on a description of just their effects, we wanted to see how people think different drugs should be available, whether they should be illegal, available on prescription, available at a pharmacy, available on licensed premises only, or legal.
Good sounds a bit useful, so it's prescribed. Yeah.
You thought that cocaine should be illegal.
Yeah.
You also thought that alcohol should be illegal.
Did I?
Yeah.
Sorry.
So number one, you said cigarettes should be illegal.
Yeah.
Do you agree with that?
Yeah.
Yes.
Number 7 prescribed was crystal meth. You thought that cannabis should be available on licensed premises. Should be illegal alcohol based on its effects.
Wow.
Does that surprise you?
So it increased. Number 4, so you think you should be able to get cocaine on licensed premises. Number 2, so you thought that ecstasy should be prescribed.
Excuse me, Matt.
Well, I think sugars a drug and should be banned, and that cannabis should be illegal. So it's what is a drug?
Yeah, it's not controversial.
Sugar's causing more issues, effects, obesity than cannabis is.
Drugs. Marijuana, that's the thing for, I know my nan, my grandmother, and she was in so much pain, and we cousin came down, that got rid of the pain.
You think that?
Right, I don't smoke, I don't take drugs, I don't smoke cannabis, but yes, I think it should be legalised.
So do you think that should be legal then for those reasons?
Well, yeah, maybe prescription or something.
I think that tobacco and alcohol is extremely harmful, but because it's part of the social fabric of society, it's lessened in terms of people's imagination about what is harmful and what isn't harmful. People who take drugs can't be classified as criminal per se because, like you said, it's to do with the classification of the drug. If it leads to criminal activity, then that's a different matter, isn't it?
I don't think drug users should be treated as criminals. I think they need help.
Well, they've legalised it in Holland. Their drug usage of more potent drugs have reduced.
I think that there have been so many tried and tested experiments done with people who are addicted to very, heroin and so on. Like, for example, giving out free needles and all the rest of it. That's all been tried and tested before, and it creates such a furore that you will never please everyone. It depends when people look at the statistics. So in government, there's got to be a level of compassion and a level of information.
After speaking to people in Liverpool, we found there's strong appetite for reform of drug law in the UK.
The results of our Choose Your Poison challenge were interesting, and we found that based on just their effects, many people wanted tighter controls on alcohol and tobacco, and less stringent controls on some currently illegal substances, such as cannabis, especially for medicinal purposes.
We hope the government takes an evidence-based approach in its upcoming drug strategy.